name is Dr. Rotimi Bakare. I used to work for NHS as a general practitioner, but recently retired. And I'm also a pastor at Bestway International Christian Center. I like to declare that I don't have any personal interest. I'm not being paid for this, for my participation in this discussion today. Now we want to discuss about COVID-19 health awareness talk. This is for us to interact with one another so that we can give ourselves the information that we already know about COVID-19. Therefore, what we're going to talk about mainly today is COVID-19 infection, vaccination, and Black community, that is BAME at large, Black, Asian, minority, ethnic group. Now, most of us, we've heard about coronaviruses. Coronaviruses are different groups of viruses, and they cause different diseases of different severity. The latest type of coronavirus that was found in around December 2019 in China is called SARS-CoV-2. SARS standing for Severe Acute Respiratory Syndrome, then CoV, Coronavirus 2. This virus is what causes this COVID-19. COVID standing for coronavirus disease, 19 standing for the year 219. About 3 or 4 months after, the World Health Organization declared it as being pandemic because it has spread almost all over the world. Therefore, a pandemic was declared. The World Health Organization, WHO, advised us that time in so many ways, but mainly that we should wear our face mask. We need to keep our distances from one another at least 6 feet apart, and also keep washing our hands for about 20 to 30 seconds, as many times as necessary during the day. On the other hand, we can use sanitizer to rub our hands. Now, it was found that the severity of this COVID-19 was so bad, and it caused loss of death, most so in Black communities, Black people. It was, according to the Office of National Statistics, they said about 1 to 1 white death, there are about 4 Black deaths. That is, for one person that died as a white person, 4 Black people died. So, all these efforts that have been put in by the World Health Organization they don't seem to be as effective as we are expecting, because the death rate, is still increasing. Therefore, the government and pharmaceutical companies, they put heads together and worked on if they can produce vaccines against COVID-19. Luckily, within about 10 months from December 2019, some vaccines were produced. Mainly, the first one was produced at USA, Visa company at USA. Again, in USA, another vaccine that was produced was called Moderna. Now, as far as the Visa vaccine is concerned, we need 2 doses about 3 weeks apart. That is what is recommended. For the Moderna vaccine, that also requires 2 doses, but it is about 4 weeks apart. The other vaccine from USA also is called Johnson, is by Johnson & Johnson, but that one only requires 1 dose. Some other countries have also come up with their own vaccines. In the UK, we have the Oxford AstraZeneca vaccine. Again, that requires 2 doses, but it can be given between 4 to 12 weeks apart. There had been some vaccines manufactured in China as well. These are called the Sinopharm vaccine and also Sinovac vaccines. A vaccine has also been produced in Russia. It's called the Gamaleya. So we have about mainly 4 ways by which we are trying to reduce the spread of coronavirus diseases, that is COVID-19 in particular. Now, meaning that we've got to wear face mask, keep our distances, wash our hands frequently, and also get this vaccine. Now, what has been observed is that even though we said to 1 death in the white community, there are 4 deaths in the black communities. So what is surprising now is that it is the uptake of this vaccine is low in the black community. We don't know why. And this is one of the things that we want to explore during this discussion, such that at the end of this discussion, individuals will be able to make an informed decision. Now, according to the government in this country, UK, they have found no barrier as to accessibility of the vaccine. It is made available to both black people, white people, whatever your ethnic lineage could be. So there's no discrimination as to who will get it. Also, the Scientific Advisory Group on Emergencies, that is SAGE, in this country, they have said that one of the reasons why the black communities have not shown interest in having the vaccine, or they are drawing back, is because of issue of low trust and confidence in vaccine efficacy and safety, which is linked to structural and institutional racism and discrimination. This, I must say, was what they found during the document that was published in January this year. Also, there has been historical findings that blacks they don't seem to be interested when it comes to health research, including vaccine trials, which, of course, will influence the outcome, whether or not the vaccine has a particular effect on Black people or white people. But if we don't go for the trial, it will be difficult to say. Finally, to close my introduction, trust in particular is very important for the Black community, for them to be able to say that they're going to take this vaccine or get involved in this research. And again, this is because there has been issues in the past about unethical healthcare research that took place in the USA. Right. So what our discussion mainly will be upon today is that we want to let everyone know what we have come across during our readings and listening to other people, and that at the end of the day, each individual will be able to make an informed decision. In order for us to be able to achieve this, that is to say, people making informed decision, we are being able to gather together a panel of experts who are mainly doctors. But in order for us to balance this discussion, we've also invited some faith leaders so that we can hear from their own point of view as well. The first person I want to introduce is Dr. Yemisi Shokan, who is a consultant psychiatrist, and she works for NHS, National Health Service in the UK. You are welcome, and we appreciate your time.
Good afternoon.
The next person, thank you. The next person I'm introducing is Dr. John Afolayan. He also works for NHS as a surgeon. His specialty, Dr. John Afolayan, please. His specialty is spinal surgery. You're welcome. Thank you for your time. The next person I'm introducing is one of our faith leaders who actually is behind the discussion today. We are being powered by Bestway International Christian Center. So we are lucky to have in our panel the General Overseer of Bestway International Christian Center, Pastor Joseph Adeyemo. You're welcome, sir.
Thank you.
Thank you for coming. Thank you. The next person I'm introducing is Mrs. Laura Ego Bami. She is a lead scientist at one of the pharmaceutical companies in the United Kingdom. You are welcome. We appreciate your time. Thank you.
Thank you.
The next person I'm introducing is Dr. Sheung Bakare. He is a general practitioner, and he works primarily as a private doctor, but also works for NHS and helps government in advertising COVID-19 and some other interesting topics. You're welcome. Thanks for your time. The next person I'm introducing is Dr. Bode Ola. He is one of the great scientists in the United Kingdom, and he also spent part of his time as a pastor at the Bestway International Christian Center. You're welcome, sir.
Thank you, sir.
Thank you for your time.
Thank you, sir.
The last but not the least is also Dr. Adelano Fabi. He works for the NHS as a general practitioner. You're welcome, sir. Thank you for your time.
Thank you very much, sir.
Thank you. So we now go straight to discussing the concerns and questions that have been put forward by the public regarding COVID-19. The first question here says, actually this question can be answered by any member of the panel. It says, why is it that the COVID-19 vaccine uptake is low in some ethnic groups, BAME in particular? Will anyone like to take that up, please?
Mind starting with that?
Yes.
I'm sure we all have opinions on this. What we have found through engaging communities that are Black and minority ethnic groups is that there is no one answer to why the uptake is low in terms of vaccination. We saw a similar issue when it came to the initial acceptance of COVID-19 as a deadly disease. What we do know is that some of the reasons are due to preconceptions before COVID in terms of engagement with health and well-being, and to do with education and acceptance of conventional medicine. But this area is one that is subject to a lot of ongoing research, and I think one of the legacies of COVID would be renewed interest in that field.
Thank you very much. As anyone else, will anyone else like to contribute to that?
I will want to share my experience with the panel and with our viewers. I work in NHS mental health, and I actually work with dementia people, very elderly people. And most of the people working within my trust, within my group that I lead, they are Black people. So when the uptake was low in our trust, I was picked by my trust to speak to my people because I'm Black. So they want to be careful when engaging people. Why are they not taking it? So I put that upon myself. And these are the things that I've collected from them, from the staff who have refused not to take it. First of all, there is a big distrust in the government. They don't trust what the government say. When government say one thing, they do another thing. That's point number one. Point number two is that many of them are being influenced by the negative information they got on the social media. So they believe it more than what even their GP or anybody could tell them. They have a large collection of these negative things. And thirdly, and surprisingly, religion has been mentioned as one of those things. course, we know there are some religion that we say they don't take blood, they don't use blood, when they are sick, they don't use medication, they don't do all that thing. And number 4 is culture of caution. As we are all Black on this panel, we know that, like what the moderator said at the beginning, we always we say, let some people go first. Let some people go first. No, let me see what will happen first. So that culture of caution is always there, and many people are lacking on it. And finally, like the moderator said at the beginning, we all know the story of MMR in the past. So a lot of people have distrust in vaccine generally. They don't believe that what the scientists are saying, this is right, this is so. So these are the things I've collected from people who have told me. In fact, I've not even shared it with my trust yet, but these are the things that I've collected. Yeah.
Thank you very much for your contribution. The next question is directed to Laura, also Dr. Sheung Bakare, and Dr. Adelana Fabi. He says, since vaccine production generally takes several years to complete, how come is it that COVID-19 vaccine was ready within 10 months or so? Is safety not compromised? Laura?
Sure. I'd like to answer that. So just to give people who are not aware of how drugs or vaccines are produced, there are generally 4 phases to a vaccine production. So the first phase, phase 1, that's normally just looking at safety of the drug. Phase 2 and phase 3 will look at efficacy. So does the drug do what you're asking it to do? And then phase 4 is after your drug is rolled out and after it's been licensed. So what normally happens that each of these phases will happen independently. But what happened, because we were in a pandemic, these phases will happen subsequently at the same time. So you had phase 1, phase 2 happen concurrently at the same time to gather all of the data. So none of the data was compromised. There were over 1,000 documentation, which was seen by the medical research product regulators. This is the MHRA, the regulators who regulate licenses of drugs in the UK. They saw all of the documentation and looked at all of the safety implications. So in not one stage was any of that stage of the vaccine production compromised. And even before it goes through all those phases, there is also a preclinical phase where a lot of the animal studies are done. So these are doses of the vaccine in an animal model. And normally those doses in animal models are 100 times more than what you'll see in the clinical trials. So we have the safety profile from the animal models. We have the safety profiles from all of the phase of studies. And also to mention that these clinical trials, they were done in over tens of thousands of patients. So these are very, very large clinical trials.
Thank you very much, Laura, for your contribution. Dr. Sheung Bakare, would you like to bless us with your experience in this area?
Certainly, I'll be happy to. Thanks so much for initially putting together this much needed and timely talk. I would also like to say that I have no affiliations with any pharmaceutical company or vaccine company. In terms of the speed that this was produced, I think a lot of the fear and sort of misunderstanding surrounds this perception that it's a new technology or a new vaccine. It's actually not particularly new. Neither the Moderna or the Pfizer vaccines, because they're mRNA based, people assume that that's sort of, that was quick, because that technology has been around for the last 30 years, and we've had lots of experience from previous pandemics as to how we can sort of ramp up production and get production going really quickly. The other thing was that as early as sort of the end of January 2020, we already had the entire genome, a genome being the genetic fingerprint of the virus, mapped and made public from Wuhan. So that was released to the entire scientific community, such as to say that, okay, here you go. And then there was a global collective effort, so that all of the labs across the world were now working with a single focus, single directed focus on finding targets within this virus's genetic code that could be potentially sort of used or exploited for vaccines or therapies. So that's another thing. That cut down time as well. The fact that we didn't have to spend time trying individually to sort of figure out what the genetic blueprint of this virus was. That was made available very early on. The other thing that saved a lot of time is the fact that typically recruiting to trials takes a long time, because you need to find, you know, the number of cases of the actual disease to actually then do the testing on. Unless you're in a pandemic and there are literally hundreds of thousands of people with this disease at the same time, and then it's easy really to recruit. So instead of sort of months to years, the recruitment was cut down to literally weeks. They had the number of participants they needed. And just to mention, you know, in the Pfizer trial, 44,000 plus, in the Moderna trial, 35,000 plus, in the phase 3 trial. So these are not small numbers of people, you know, these are vast volumes of people that are managed to recruit. The other thing is that typically vaccine production occurs, vaccine trials through to production occurs in series, one after the other. Things now were occurring in parallel with the regulatory bodies. We know that time is of the essence. So instead of doing one thing after another, and then eventually getting to the regulators, and then the regulators start their work, the regulators and the actual vaccine producer are working side by side. So as each trial stage was being completed, the regulators are also joining them side by side and regulating and doing what they need to do as they went along. And then finally, I guess it comes down to money as well. So typically a lot of the time spent of those sort of, you know, the normal 5 to 10 years or whatever that it takes to produce a vaccine, it's just dead time. It's time waiting for bureaucratic sort of paperwork to be finished. It's time waiting for funding to come. Literally at this time, for this purpose, the entire world collectively got together and said, money is almost no object. Just get it done. And I think that was also another big contributor to how quickly we managed to develop this. There are other things, but I've said quite a lot already, so I'll stop there.
Okay, thank you very much for your contribution. Dr. Fabi, I don't know if you have something you want to add to that.
Just to add to what Laura and Dr. Shambakari already mentioned, they've explored the reason extensively. So just to add to that is that despite despite what the public perceive as the accelerated vaccine, which has now been the reason has now been explained, I just wanted to mention that the vaccines actually, what tends to happen is the vaccines, what we know is that the MHRA, which is the Medicine and Regulatory Healthcare Products Agency, actually scrutinize rigorously every new medication or vaccinations after the clinical trials just before they are released or rolled out for public use. Another important thing is to mention that with any new medication, no medication or vaccine is completely risk-free or 100% effective. But what has been ensured is that before these vaccines are released for public use, they have been ensured deemed safe. They've been authorized and licensed by the regulatory process. So that was just my addition.
Thank you very much for your contribution. The next concern we have here, it says COVID-19 vaccines, could it contain a microchip? Some people are talking about it. Can you please help us entangle this, area? Laura, please.
I believe this is one of the myths that's been circulated around social media. So there was, I believe there was a video clip from Bill Gates talking about a digital certificate. and a lot of people read that as being a digital microchip that's going to be inserted. And if you think of a microchip being a metal. So what's in a vaccine? The vaccine mainly, the constituents of a vaccine is mainly water, and it also contains lipids, and it contains for example, with the Moderna vaccine would be the genetic material, the messenger RNA. So lipid, water, microchip, it's a metal. There's no metal. There's no metal in the vaccine. So this is just a misconception. And what people have seen in the social media, from what Bill Gates, extracting what Bill Gates has said, taking that literally to say this is what he's meant, and he did not mean a microchip. He talked about a digital certificate, which is not, that's just false information.
Okay, thank you very much, Laura. So people can put their mind at rest as far as microchip is concerned. Yeah. Okay, thank you. The next question is going to be directed to Laura again. Dr. Bodeola, please get ready. So the next this question here, it says, how many different types of COVID-19 vaccines are currently available?
Sure, that's fine.
Which ones contain messenger RNA? Does any of the vaccines pose danger to our DNA as far as we know today? I know there are about 2 or 3 questions packed in this one question. Should we, I think anyone can, either Laura, Dr. Badiola, Dr. Shimbakari, please feel free. Any one of you can go first.
Okay, I believe you've already.
Yeah, Laura, go ahead. Go ahead, Laura.
I believe you already mentioned these in your opening remarks. So we know that both the Pfizer, the Moderna vaccine, as well as the Pfizer BioNTech, these contain the messenger RNA. So this is the genetic code which has been basically has been sequenced, the whole genome sequence, and that information is what's used to target the spike protein. So the coronavirus has a protruding spike protein, and this spike protein, we know that these is what actually allows the virus to get into a cell. So the Moderna and the Pfizer BioNTech vaccine have the messenger RNA. So I believe the next question is that, can these alter your DNA? Can they get into your DNA?
Yes, it's asking, can the messenger RNA cause problems, go inside the nucleus and cause problems with the DNA?
So I think just to kind of just breaking this down, so this is coming down to just basic genetics. So messenger RNAs are nucleotides, so they're single nucleotides, whereas DNA is a double-stranded nucleotide. So once the messenger RNA basically gets into a cell, it's rapidly cleared, so it's not going to go anywhere into your nucleus. Your DNA is in your nucleus, so there's no way that messenger RNA, basically it's just there to, as the name implies, as a message, it's carrying a message to get into a cell to be able to make a protein. So it has to get into the cytoplasm and translate to make a protein, and that's all it's doing. It's not going to go into your DNA.
Thank you very much, Laura, as usual. Dr. Shimbakari, please.
Hello, thanks. I really don't have very much more to add to that, except for the fact that as human beings, we don't possess the enzyme that would allow mRNA to enter the nucleus anyway. So it's just a physiological impossibility, basically. So
thank you. Dr. Bodiola, please.
Just as a scientist too, this is the basic thing that every non-scientist needs to know is being laid down by Lara there. But the only thing I want to mention about the beginning of it, which is how many types of vaccine which you have really dealt with. But I just want to focus on the one that is available to us presently in UK, which is the Pfizer and the AstraZeneca. And the reason why we are holding this meeting is just to make sure that all our viewers who are of Black origin, they make an informed decision. Pfizer, as when it was being tested, like all the panelists have said, uh, they were able to test 9.6% of Black, African, Hispanic, and Latino. And this is why all over, this one is able to go a lot of places. And for the Asians, 3.4% of them were tested during the testing phase. And regarding AstraZeneca, is 10.1% for Black and 3.5% Asian. Now, this goes along with what you said earlier on, that if Black have really been able to come forward, I'm sure they will have got a better percentage. But the good news is this has been tested on our people, on our Black people. So there is no concern about it. So the two vaccines that are going on in UK today, which is Pfizer and AstraZeneca, they've been tested, proven to be good. A lot of people have taken. They're talking to you and many of the panelists we have taken. So they are good. So I know that the other one, Moderna, is being approved by MHRA, but it's not yet been given here. And the other one, which is from US, Novavax vaccine, is also being considered. So, but presently, only two are in circulation right now as we speak.
Thank you very much for your contribution. Well, the next concern or question is being directed to Dr. Yemisi Shokon. The question here is, there have been cases of some frontline workers who, probably due to stress of work or finding it difficult to cope, seeing patients dying from COVID-19 infection, have become distressed and depressed, so much so that they had sought psychiatrist assistance. That's one part of the question. The other part of the question is that also in post-COVID-19 infection, especially in severe cases, some patients have become so depressed as a consequence of the complications of COVID-19. Some needed the help of psychiatrists. Please, can you comment on this?
Thank you. So I'll first tackle your initial question, which is about healthcare workers, especially those in the front line presenting with psychiatric symptoms. This pandemic is really high profile, and what we are seeing is that they're predicting an epidemic of mental health disorders in frontline workers, even at the end of the pandemic. We're already seeing people coming up presenting with severe, symptoms of post-traumatic stress. Now, post-traumatic stress disorder is something that is also called combat stress or shell shock, in reference to soldiers who present with psychiatric symptoms after they've been on the war front. Working in ITU as either an ICU staff or an anesthetist is not dissimilar to being on a war front during this pandemic. There was a study during the first lockdown between June and July of ICU workers and anesthetists, and that showed that as high as 45% of them presented with psychiatric symptoms. This included depression, anxiety, sleep disturbance, even suicidal thoughts, and turning to drugs and alcohol. Now, who is likely to be affected? Because 45% were found, it just means not everybody got to present with psychiatric disorders. We found that females are more affected than males, and people who are more exposed to this trauma, and by this trauma, I mean seeing more death than one would expect these workers to see in the line of normal duty, lack of support, not getting adequate PPE, having a previous psychiatric history, having to make difficult decisions like who goes on the ventilator or who gets a bed are factors which would mean that somebody is more likely to get this symptom or not. A lot of healthcare workers are now coming across with depressive symptoms like low mood, lack of energy, increased or decreased sleep, lack of interest. Some even feel guilty about having survived the pandemic where loved ones have died. So yes, there is an increase. And we're recommending a very, very high index of suspicion and a low threshold for staff to come out and seek help, either informal help, I mean, like church or faith-based groups, social support, going to the GP, or even referral to secondary care services if any healthcare worker feels that they're having any of these symptoms I listed or more. Now, with regards to patients presenting with psychiatric illness after the COVID infection, mental health disorder, post-viral illness is quite common. And some of these symptoms can mimic prolongation of the viral illness or can be a separate entity in itself, because we know that with the COVID, people have fatigue, shortness of breath, what they call brain fog, and all sorts of other symptoms. Some of these psychiatric illness or symptoms that they eventually develop can mimic prolongation of the actual viral infection itself. But again, the symptoms are similar to the symptoms that I mentioned earlier, which is depressive symptoms, anxiety, guilt feelings, lack of interest, loss of energy, turning to alcohol or drugs for that matter. So we're recommending that people should not delay seeking help if they develop any of these symptoms. Thank you.
Thank you very much for your contribution. It's invaluable. Thank you. Please, does any of the panel members have anything to add to that? Okay, then we move on to the next question. This question is directed to Pastor Joseph Adeyemo, please. He says, what other concerns have people shared with you being a Christian faith leader?
Thank you, Doctor, and thank you for putting this together. And I thank all the medical professionals that joined us today to enlighten us on this matter. As a faith leader, I do not have, the qualification to advise people on medical matter. But I mean, we thank God because of the people that God has given the wisdom to do this on our behalf. And we know that this wisdom comes from God. People have been so concerned. I think the most important thing is mistrust. What has happened in the past regarding Black community. I've been involved in different meetings, as a faith leader, and the concerns of people is all about that, they have not been treated ethnic minority well. So I don't trust them. This thing is so quick. And so all these things are the concerns of people. And also, as a faith leader, some of the things, that concerns people is what they have been, that has been mentioned before, is what they are hearing and seeing on WhatsApp, on YouTube, on, what other faith leaders were saying about this vaccine. And these are some of the things that make people so weary and not try to take this vaccine. Uh, uh, and I believe that, as we come together like this, we can help to inform people, because this is all about information. It's not that we are telling people go and get the vaccine. What we are doing is that have the understanding of this vaccine and then make your decision. So, and those are the things that I've heard from people, and I believe that is being addressed one by one.
Thank you very much, sir. Our next question is directed towards Dr. John Afolayan. It says, since the beginning of COVID-19 pandemic, many routine operations have been postponed. And why is this so? Can you please comment on this? Dr. John Afolayan, please.
Thank you, sir, for that great question. We all know about the direct impact of COVID, and there were a lot of indirect impacts. So this is probably one of the first times, certainly in our living memory, in which the whole world, certainly the whole NHS, effectively stood still to just address a singular problem. You had people like me, a specialist surgeon, and we had to change what we did, because what we had to do was to treat people that were basically dying. A lot of us took up nursing duties and other non-technical skills just to get people through. So everything effectively had to be cancelled, bar for the most urgent things. A recent study was released by Oxford Group, which showed that we have around about 4.5 million cases as of November last year that were waiting on the waiting list. You have to compare that to the fact that we're almost at a historically low GP referral rate since 2019. So GPs are not working properly, so they're not referring patients. Yet we have a waiting list that's around 150 times what it is this time in 2019. Another very interesting study showed that worldwide we have around 28 million operations that were cancelled or outstanding due to the pandemic, of which the most urgent areas are trauma orthopedic surgery, oral surgery, and plastic surgery. And this includes cancer cases, which also were cancelled. Current forecast in some circles is maybe 2 to 3 years for that backlog to be cleared. So the reason for that is because every resource had to be diverted to treating this deadly disease. And it's only now that governments are starting to get back into planning for the backlog. Care providers like myself, we're starting to look at what it would take to catch up with the waiting list. And really, it's a big issue, but governments are working on solutions, and healthcare professionals certainly will do their best to clear the backlogs, starting from the most urgent cases first, and then filtering down.
Thank you very much for your contribution there. The next question, again, I think is directed to you, Dr. John Afolayan, and also Dr. Seun Bakare. It says, what are the efforts of the scientists, the medics, and the government in controlling COVID-19, in addition to the basic advice of the World Health Organization? Dr. Seun Bakare.
Yeah, so in terms of sort of COVID mitigation measures, the main thing at the moment has been this sort of social distancing and an effort to break the chain of transmission, which as we've seen has been relatively effective so far in sort of helping to reduce the rates, the basic day-to-day things that we mentioned about hand hygiene has also been very effective. But surveillance is really what the World Health Organization was sort of really trying to advocate very early on, that testing, and tracing as well was the sort of cornerstone to effective sort of control and management of this pandemic. Now, I mean, our test and trace, I'll leave to to you to decide whether or not that's been effective as a strategy. But at the moment, it would seem as though the vaccines are probably the strongest move that we have. We hope that there will be some seasonal suppression of the virus with the sort of coming slightly warmer months. And then surveillance. So we have different types of tests available to us. There's the slightly more sophisticated one that takes sort of anywhere from 4 to 24 hours to process. And then there are sort of simpler ones called rapid antigen tests. And these are able to be deployed, administered, and you'll have a result within about 20 minutes. These have been given to sort of most, if not every, sort of healthcare worker, and both in primary care and secondary care, so in GPs and hospitals, as a means of just sort of making sure that on a day-to-day, we're able to say confidently that we're not going in and being potential vectors to transmit this to our patients, because we're then testing ourselves at home in the morning before we go to work on a twice, sometimes 3 times weekly basis. And that's just another measure that's being taken. I think we've seen that in schools, part of the drive, because we know the transmission does occur contrary to what was initially believed in school-age children and young people. There's now been a drive for the rapid antigen testing that I'm talking about to be deployed in schools. And so returning children will be having these tests as well, again, as a means to break the chain of transmission and to detect early those cases that may be positive.
Okay, thank you very much. Dr. John Afolayan, do you have anything to add to that?
Yeah, sure. Not to add
Please go ahead.
too much. Not to add too much. I think Bakary gave a good distillate. But I think what we have to appreciate with COVID and this process is that the knowledge acquisition has been quite fluid. Not many times have we had to learn on the job effectively as scientists and as medics. And that's why you find sometimes that the advice that's given, even from the scientists or people like WHO, appears to be a little bit fluid or appears to change, with the example that Dr. Bakary just gave. All I will say is that, once again, with this kind of singular unifying disease, all governments have some sort of strategy. They all have a plan. But of course, there is a significant limitation of what governments can do depending on the resources that are available to those governments. And I think that's where it becomes very important. Once again, I commend you, Dr. Bakary, Senior, to host such an event, because the education of ourselves is really, really important in helping to aid some of the government plans and also to curb the ongoing infection.
Okay, thank you very much. The next question actually is going to be, it's a general question, really. Anyone can please, chip in to this. It says, is it true that some countries are already deliberating on requesting COVID-19 vaccine certificate for entry visa?
Yeah, the US, Australia, the UAE, Greece, and other parts of Europe are considering it at the moment.
Right.
Yep. France, Spain, Denmark.
Yeah. And how about the
Sweden.
UK?
They are, but I think there was a petition recently in which 200,000 people signed because they didn't want the introduction of such. Whether we call it a vaccine visa or vaccine travel certificates, to my mind, it almost seems inevitable as part of whether you call it track and trace, thought about involving it with the NHS app. But in some ways, there needs to be an understanding of how people are moving when you're talking about a virus that potentially can be transmitted from person to person. So I think in some ways it's going to come in. It might just be the language that is used to make people feel better.
Okay, thank you very much. So to those of us, to those who have not yet got the vaccine, that is an important information because we don't know where we are going yet, in the future with this
Sorry, sir.
COVID vaccine.
To add to
yes, that. Dr. Ola, yes.
Just to add to that,
yes.
Dr. Afolayan he's really heated. Yes, right now we don't know. Right now, no country is doing it, but we all know yellow fever. There is a yellow fever vaccine passport. You cannot go to certain country without showing evidence that you are vaccinated against yellow fever. And with the uptake of the vaccine now presently, it is going to be inevitable. So people should get ready to get it.
Okay, thank you very much for your contribution. Now, this is a little bit different question is here. It says, since COVID-19 does not appear to be severe in children and young adults, that is, young adults without underlying conditions, why are we concerned that they need to observe basic WHO advice? Anyone, this is a general question, please. Anyone can chip in. We're talking about the children and young adults in particular.
I think it depends on what you consider severe. The sort of medical definition of severe is someone who requires hospital assistance. However, you can suffer quite severe shortness of breath, debilitating fatigue, fever, and just be completely incapacitated. And yet, because you don't quite require oxygenation or support, you're not deemed severe enough to be in hospital, but you're at home. That doesn't mean that it's not a significant illness that you've just suffered. You're still, we shouldn't confuse the fact that it's not severe, quote unquote, with it being necessarily mild or something to be taken lightly. There are people who have suffered very severely from this, but because they weren't what we call hypoxic or dropping their oxygen saturation, but they were suffering quite badly from muscle aches and pains, severe headache, fever, and other symptoms. But because they were not hypoxic, they did not go to hospital. So we must not confuse the two. The medical definition of severe means that you need oxygen. But clinically, you can suffer symptoms that are very debilitating. In addition, this isn't really about you as an individual. Yeah. So because you may suffer mild disease, that's almost irrelevant because we know that there are groups of people for whom this will be very, very dangerous and very risky to their health. And we all know those people by virtue of the fact that most of us, but thank God, still have parents that are still alive. Most of our parents are above the age of 65, potentially in their 70s. They are potentially vulnerable people. We all know that there are people who we come in contact with at work, and no one knows necessarily what the kind of burden health-wise that person is carrying. But if you do transmit this, it can be very problematic for that individual. And the main issue is that you may not know that you're transmitting it. So the fact that you may be okay, you may not, but the fact that you may be okay is not the end of the story. It's the fact that you can transmit this virus without knowing, and then you can then put someone else at risk. And that's
Thank you for that. But I just want to ask a question there. Does it mean that the school teachers could also be at risk?
Absolutely. But they're now performing surveillance as a means of trying to mitigate that risk. So the children are tested twice a week. as a means of trying to catch and break the chain of transmission, if there is one.
Okay, thank you very much. All right, the next question here is, how long does it take for antibodies to be formed following COVID-19 vaccination? There are more questions that follow that. And then it says, how long does the protection last for after you've had the vaccine? Then it says here, after vaccination, could one become infected? So these are about four different questions.
I'll take the easy question. The last one, the answer is yes. And I'll leave the rest to my esteemed colleagues to answer.
Okay.
No, absolutely, can be. What I've read, I mean, Dr. Bakare, I'm sure Bakare can comment on this. So in terms of the formation of antibodies, it's an interesting area actually, because I think based on my latest reading, we think probably between something like a week to 3 weeks for it to form, depending on whether it's your first dose or your second dose. How long it lasts is a variable feast, and Dr. Bakare, I don't know if you have any more information on that particular side of it, in terms of how long it potentially lasts.
The jury is still out on that. There's emerging evidence to suggest that 6 to 8 months is the sort of time we'd expect. We do know that in terms of the immunity that you gain from the vaccine, it's stronger and more robust than the immunity you get from actually having had COVID itself. So the vaccine provides stronger, longer lasting and more robust immunity than you having had COVID-19 disease itself. So there is that distinction there. But there is ongoing research to sort of try and figure out exactly how long that immunity will last for.
Yeah, I guess just to add to
Thank
that.
you very much.
Sorry,
Laura.
Sorry, just a quick.
Yes, go ahead,
yeah,
please.
just talking about the immune system. So that there is ongoing research. So the immunity that you get from the vaccination is really from your B cells, which make your antibodies. So you have your memory B cells, and there's a lot of work that's going on to see how those memory B cells last once you've been vaccinated.
Okay, thank you so much for that. This next question is directed to the pastors in the house. It says, as my faith in Jesus Christ is strong, I agree with my pastor that I do not need COVID-19 vaccine. And then it says, could that be mark of the beast? And it says here, do you believe in medications or vaccines? That question is directed to the pastors in the house, please. Pastor Adeyemo and Pastor Ola.
Okay. Since I'm not a scientist and I'm not a medical personnel, I can answer this question. Yes, we are people of faith. We have faith in God, and we believe that God can do all things. But I want us to understand something, that, thousands, if not millions of Christians who believe, who have the same faith as we had, has lost their life during this pandemic. It's not that they do not have faith, but this dangerous pandemic virus, kill them. So, when we talk of faith, we need to remember that that faith is not just, for us. It's for everyone around us. And the doctors, the scientists have been talking about how this, even if this pandemic is in your body and it's not affecting you, you don't see the physical effect of it. you can transmit it to someone else. And Jesus tells us to love our neighbor as ourselves. So in loving our neighbor, we need to, think beyond ourselves. We need to think about others. We need to think, and we need to, make sure that we become our neighbors' keepers. Our children will go to school with their children. Uh, many things, there's no way that we will not interact. And because of this, we we need to make sure that we work together with the scientists, the doctors, the researchers that have done great work, that we all agree with them, with our faith. In fact, without faith, nothing will work for you. So with our faith, then, we take our part. I've taken my own anyway, so I can say that with confidence. My wife has taken her own. But what I'm saying is that, it's not that I don't have faith, but my faith, the Bible tells us that, God has given us the spirit of love and power and sound mind. We need to show love to others. We need to make sure that we, we stop the spread of this pandemic, and we can all we can only do it together. If we don't do it together, if some people are trying their best and some are not doing it, it's going to take long before this pandemic could stop. The other area is, could this be mark of the beast? Personally, I do not believe that the vaccine is mark of the beast, because it does not even match anything. You can't compare it to what the Bible tells us about mark of the beast. We have not even seen the beast yet. So, how can we be talking about mark of the beast? And when the mark of the beast is going to come, the Bible tells us about the first beast who will come from the sea, and the second beast who will come from the earth, and that we have power over the first beast. And it was that beast that we ordered that, people should give, they should give people his own sign, which is 666. That is going to be on their right hand or on their forehead. So don't let us, this one is not mark of the beast.
Thank you very much, sir. Thank you. Dr. Badiola, do you have anything to add to that, please?
Yes, just not really much, just only one point.
Okay.
Wisdom the scientists use to make vaccine is from God, because the Bible that we all believe says wisdom comes from God. There is no other wisdom outside God. So God gave the scientists this wisdom to make it. So if God gave them the wisdom, and you say you are a man or woman of faith, then you need to agree with the wisdom of God. And like my GO said, allow that wisdom to mix with your faith and allow that to work for you. So wisdom is of God, and wisdom was used to make this vaccine.
Thank you very much, sir. Thank you. All right, the next question now, I'm trying to move on quickly, is directed towards the scientists and the medics in the house. It says, can a breastfeeding mother or a pregnant lady have COVID-19 vaccine? I'm going to put together many questions just in one. Can a breastfeeding mother or a pregnant lady have COVID-19 vaccine? How does COVID-19 affect a pregnant lady compared to a non-pregnant lady? And then, does COVID-19 vaccine affect fertility? So there are about three questions are put together there. Yes, Laura, please, I can see. Are you?
I'll start maybe I'll start from the bottom, work it up. So I'll probably take the fertility question.
Yes,
so
go ahead.
what's been shown in the studies that they haven't really looked at pregnant women in the studies, but what has been shown is that people who were planning to become pregnant, who had taken the vaccine, they didn't have any trouble in conceiving for a child. So that categorically shows that the vaccine doesn't affect fertility. So this was a study that was done, and also in another study where people who had contracted COVID during their pregnancy, either died or the fetus died. So showing that those who weren't vaccinated during the pregnancy did die from COVID.
I see.
So that's just a study.
Thank you very much for that.
Yeah.
Any other addition to that, please, from the scientists and the medics in the house?
Yeah, so there's currently no evidence to show that there's any risk with giving a pregnant woman the inactivated virus or a bacterial vaccine. But today we're not routinely vaccinating pregnant women. This is simply because pregnant women were not involved in the vaccine clinical trials. So there's not enough information about that. So it's just a principle of safety in pregnant women at the moment. However, there are a few circumstances where it's probably best for a pregnant woman to have the COVID-19 vaccine. So as an example, if a pregnant woman, say, is at risk just by virtue of where she works, or she's at risk because she has a medical condition that predisposes her to developing severe complications from COVID-19, then it's probably in her best interest to have COVID-19 vaccine. So what tends to happen is she then has a discussion with healthcare professionals, her GP, her doctor or a nurse. And what we need to do is to advise the woman and explain to her, and then reassure that what the vaccine contains is the inactivated virus, not a live virus. So it's absolutely incapable of reproducing within the cell, and definitely incapable of causing harm to the baby or causing harm to the pregnant mother. So with that being said, if a woman discovers that she is pregnant after she's had a course of the vaccine, what she needs to then do is to complete the pregnancy before she completes the recommended schedule of the vaccine. Obviously, except in cases where she's at a very high risk of developing complications from COVID-19 vaccine.
Thank you very much, sir, for your contribution. Now, the next question here is, what are the side effects of COVID-19 vaccine? Any clinician in the house can please chip in.
Could I just very, very briefly buttress what my colleagues sort of said previously with relation to pregnancy? The research is ongoing. There has been a study that is about to be published very shortly. It was done at Harvard, looking specifically at 131 women of reproductive age. 81 of them were pregnant, 20 of them were breastfeeding. It demonstrated that actually the immune response was very similar to non-pregnant women, and that they did find and were able to detect the antibodies both in the placenta and also in the breast milk, but that it was safe for these pregnant women, that there was no sort of harmful outcomes. This is from Harvard, and it's about to be published. It's a relatively small sample size, but there's emerging evidence. With relation to the side effects, most of the side effects that have been documented throughout the trials, they include things like perhaps a sore arm, maybe a bit of a headache, muscle pain, perhaps a slight fever. This has nothing to do with any suspicion of a virus or anything like that at all. It's more your immune response in producing and generating the immune cells, basically, and the antibodies that you require. These symptoms typically don't last for longer than a week. And in fact, most people anecdotally shake these symptoms off within about 3 or 4 days maximum.
Okay. Thank you very much for your contribution.
I was gonna add to that quickly, but I think
okay.
The symptoms are quite varied. So the first thing, completely, once again, buttress the point that Dr. Bakare and Dr. Fabi has made about fertility and breastfeeding. Those undergoing maybe IVF treatments or fertility treatments, once again, has been shown to be safe. But the only caution that was advised was in regards to the symptoms that Dr. Bakare is talking about, in that because of the potential mild symptoms that you may have, to think about the timing of maybe IVF treatment or egg harvesting or whatever it is, in the context of the symptoms that you may have. So maybe space it out in terms of the treatment days versus days that you're having your vaccination.
Okay, thank you very much for that. There are 2 or 3 questions here, which I'm going to put together. And anyone can actually answer this, but probably mainly for the medics. It says here, are all NHS or medical professionals going to be required to take vaccine or quit their employment if they don't take it? That's one question. The other question is there any underlying health conditions to consider that justifies anyone refusing to take COVID-19 vaccination? So there are 2 questions I put together there.
I can have a go at the first question.
Okay.
But right now, I'm having a discussion with a lot of staff in my NHS. Nobody have said it. Even government guidelines have not said if you don't have the job, the vaccine, you are going to lose your job. But it's an emergent thing. It could get to a stage where you say you are you are a frontline staff and you are not vaccinated. Your colleagues are going to be suspicious of you, like all the good answers my panelists have said here. You may be strong, but you can be a carrier. So if I have my full dose of vaccines, will I be confident to work with you? We don't know what could happen in the future. You have your right not to take vaccine, and I have my right to be protected, not to be in the vicinity of somebody who didn't have vaccine, So it's going on. But presently, we were sure that this is not government position yet, but you know what it could be. It could become a position later. But presently, no to the question.
Okay, thank you very much. A question has just come in. It says, I heard that in Sweden, they have stopped giving AstraZeneca because of the severe complications. It didn't mention which complication it is. Can you please share more light on this? Anyone can please throw light to this if you've heard about.
I think there was some.
Yes, Laura.
In Denmark and in Norway, there was some issues of blood clotting, and I believe that's the case he's referring to. So, what's been shown is that the vaccine, although it's still ongoing, I'm not really know if there's a direct link between the vaccine and blood clotting. So this is very, very rare. I think there's what's been shown is that in out of 5 million people who have been vaccinated, 30 of kind of blood clotting cases have come about. So if you do the maths, that's less than 0.001%. So it's a very, very small percentage of this is what we call an adverse effect of the vaccine. So very, 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 very rare cases that we'll see this, but it has been shown, but it needs to be investigated what has caused this, because you have to kind of look at what's the underlying, medical history of a patient. Are they hemophilic? Do they have an ongoing low blood clotting disorder? So I guess it's not taking things in isolation, but looking at everything holistically, and just, I guess there's a lot of work and investigation that has to be done around that to understand why this has occurred. But again, it's just to point out that it's a very, very low percentage of people that this has been seen.
Thank you very much, Laura.
Yes,
somebody wants to add to that?
Yeah, just very briefly, because there'll be lots of these small things that crop up. One of them was, Bell's palsy. The other one was, it causes sort of weird autoimmune. Listen, what we have to look at is there will always be things that creep up amongst the population that are taking the vaccine. What we have to look at is what we call the background risk, right? So we compare it to the general population and then the population taking the vaccine. And if the rate of this so-called adverse effect is lower than the general population, then it's really, we have to look really carefully, is it really an issue? Understand? So if within the vaccine population it's 30 in 5 million, and in the general population who don't take the vaccine, it's 100 in 5 million, then is it really an issue that we need to be, concerning ourselves with?
Yeah. Okay.
And also very quickly, Dr. Bakare, let's not forget that COVID in itself makes people very prone to blood clots. Exactly. So I can't remember the exact percentage, but catching COVID in itself makes you extremely prone to blood clots. So once again, it's just about a balance of information.
Yeah. Okay, thank you very much. Well, we are getting there. We are almost there. The other thing, what we need to consider now is the current guidance for fully vaccinated people. The Center for Diseases Control and Prevention, CDC, this was about a week ago. They came up with some guidance, which are actually conditional, and they need to be updated and expanded based on, one, the level of community spread of the virus, that is the SARS-CoV-2 virus, two, the proportion of the population that is fully vaccinated, and three, the rapidly evolving science on COVID-19 vaccine. So these are the conditions that they have given before they even make their guidance and recommendations. Now, the recommendations they gave, this is mainly, I must say, in the USA. I'm not really sure yet what or if the UK is going to adopt it. Now, they said that, how do we define somebody that is fully vaccinated? If the person has got vaccines from Pfizer, Moderna, Oxford, and AstraZeneca, which require 2 doses, then minimum of 2 weeks after they've got the vaccine, then we can say that a minimum of 2 weeks after they've got the second vaccine, then we can say that they are fully vaccinated. Whereas in the case of Johnson & Johnson, which requires only 1 dose, then it will be 2 weeks after the only dose. Then we can say that this person has been fully vaccinated. Their recommendations are, 1, if you are fully vaccinated, you can visit with other fully vaccinated people indoors without wearing masks or physical distancing. That's 1. 2, visit with unvaccinated people from a single household who are at low risk for severe COVID-19 disease indoors without wearing masks or physical distancing. And the third recommendation or guidance they gave is that one can, if you are fully vaccinated, you can refrain from you can refrain from quarantine and testing following a known exposure if asymptomatic. All these are like saying this is where we are going, but don't take a step yet. For the meantime, they are saying even if you are fully vaccinated, because it's not everyone that is fully vaccinated, and we haven't even got enough vaccine to go round, we have to continue wearing our face mask, keeping our physical distancing, avoid minimum or medium or large sized in-person gathering, get tested if you're experiencing the symptoms, follow the guidance issued by your individual employer, and also follow the CDC and health department travel requirements and recommendations. Well, I think what is left for me to do now is to round up. But before we do that, I would like our panel to give us their closing remark just in 1 minute, each person for a minute, just give your closing remark, and then I will give a talk. If we follow this order, Dr. Yemisi Shokon, please. Can you give your closing remark, please?
Thank you. Now, looking forward from a community perspective, it's important to encourage people to seek help appropriately if they're having any symptoms suggestive of mental health disorders. It's not just secondary services that they need to be seeking help from. Informal help is actually valuable, like what you get from family support from faith-based groups, even like the church, or your GP. And then on top of that, prompt referral to mental health services for either frontline workers or even members of the public, because this is a very traumatic thing. And we're all having to adjust to what we didn't actually see coming. So prompt risk assessment of staff that work in this frontline is very, very important, and giving them access to childcare facilities and things that would avoid burnout. Now we don't have problems with getting PPE. Most frontline workers are vaccinated if they would accept it. But identification and referral to the appropriate services will be very, very important going forward to prevent this tsunami of mental health disorders that is being predicted. But we must not overlook the importance of informal support, like from churches, family, and the other social groups. Thank you.
Thank you very much, Dr. Shokon. Dr. John Afolayan, please.
Thank you. So once again, thank you, Dr. Bakari, for organizing this. And two parting statements, really. The first is, I hope that anyone that's listening makes a decision based on information, based on appropriate information, and based on self-education, as opposed to based on fear and some of the things that we're seeing in social media. Because this episode with COVID has almost given a blueprint of what's going to happen with a major event now and in the future. So one is just to kind of engage in that process of self-education and get some information from the right sources. And second point really is just to support the statement made by Dr. Sokon, meaning that what we are seeing, government's going to do so much, particularly when it comes to the issue of support and psychological services. There is a real need for communities like ours, including faith groups, to really galvanize themselves and to prioritize the well-being of their congregation and of their communities. We have to take the lead in this.
Thank you very much. I would like to invite Pastor Joseph Adeyemo to please give us your closing remark.
Thank you, sir. Thank you all for all your enlightenment on your professional life. We see that this pandemic has taken millions of lives. And through the wisdom of God, the scientists have been able to unravel the DNA of this dangerous virus. And the doctors, all the people, the people on the front line, they are working tirelessly to treat people. And also, I mean, we see that, everybody is working together. All what I can say is that let us allow faith to rule over our fear. Let us allow faith to rule over our fear. Government cannot help us at this time. We have to work together to do this together. And I want to encourage everyone, based on the information and the enlightenment that you have received today, please make a very positive, informed decision. And that together we will conquer this virus. God bless you.
Thank you very much, sir. Please, Mrs. Laura Ego Bamin, please. Can you give us your closing remark?
Thank you very much, Dr. Bakare. And I'll just finish by saying that what we've heard today, hopefully what we've heard today, is that the scientific evidence, we've been able to separate the facts from the myths. Hopefully you understand what's in the vaccine and what's not in the vaccine. Hopefully that will help you to guide your decision making. The Prime Minister a couple of weeks ago outlined the roadmap out of this pandemic, and I leave it in your hands to outline your own roadmap out of this pandemic. In the UK alone, about 125,000 people now have died from COVID. So the decision is really, really in our hands as we try and ease this pandemic that has devastated so many lives. This is the first time scientists, doctors, frontline workers, the whole community are coming together. And for me, that's quite powerful to have communities working together. So everyone, has already said, is playing their part. I leave it in your hands to play your part.
Thank you very much. Thank you. We appreciate your time.
Thank you.
Dr. Sheung Bakare, please, can you give us your closing remark?
Again, thank you very much for arranging and organizing this much needed talk. It's really just to echo what my esteemed sort of panelists and colleagues have mentioned already, and just emphasize that this really isn't about you as the individual alone. We have to think bigger and a lot more broadly than that. It's about us as a collective and how we collectively emerge from this. We've seen already that the decisions that we make impact all of us. We've all now been in lockdown for a good amount of time, and we do have a road out of this. We have a way out of this. It very much involves adhering to recommendations, but also a big part of it is the vaccines in order to achieve a good amount of coverage and herd immunity. Now, it's fine to have questions. I think it's actually healthy to have questions, but I think what's also healthy is to seek answers from the correct source. What we have to concede is that if you're not necessarily a scientist or someone who is experienced with this, that you may not have all the answers, and that neither does Google or WhatsApp or Facebook, and that it's fine and okay to ask people who may have more information or could signpost you towards where you need to go to get valid, accredited, good information. And that's what I'll say. We'll get through this together.
Thank you very much. Dr. Bodeola, please, can you give us your closing remark?
Thank you, sir. And thank you for organizing this. Thank you for the church itself, Bestway International Christian Center. And I hope that a lot of our members will take the opportunity of information that we have discussed this afternoon. My conclusion will be, just as you said at the beginning, the purpose of this meeting is to help people to make informed decisions. So here today, 3 things have been laid bare and clearly been expatiated on. Number 1, coronavirus kills. There's no doubt about that. Number 2, the vaccine, coronavirus, is safe as at today. to all the people that have taken it. And finally, this coronavirus vaccine, it saves life. So you need to choose, if when you are making a decision, make a correct decision. Then you have two things in your hand. You have a virus that is killing, and you have something that can save. So when you are making your decision, use everything you've had from this panel today and make sure that you made the right decision. Thank you.
Thank you very much, Dr. Vodela. The last but not the least, our general practitioner, Dr. Adelano Fabi. Please, can you give us your closing remark?
Yeah, thank you very much, Dr. Bakari, for this platform. So mine is just a bit of message to anyone who's currently listening and they're in a place where they're still skeptical about receiving the vaccine. I just wanted to say that just like Dr. Sean Bakari has mentioned, we have a way out now. The vaccine is the single most effective way to contain or control the virus at the moment. So it's important if you're still skeptical to seek information from the appropriate quarters. So there are a lot of resources online, but some of them are very helpful while others are very ridiculous. So it's probably best to speak to a medical professional so you are guided in the right direction. And again, we also want to protect ourselves. We want to protect our loved ones, and the community at large. So it's up to everyone to make that decision based on appropriate information. Thank you.
Thank you very much. Well, all that is left for me to do now is to say a big thank you to all our panelists for your time, for your professionalism, and for your advice. I hope that from what we have discussed today, people can make an informed decision so that in the end, we shall not have cause to blame ourselves and say, oh, had I known. You know now, so everything is in your court. And I hope that you will make the right decision. Thank you very much, all our panelists, once again. And I hope that when next we call upon you, you will not mind helping us again. Thank you, and God bless you. I also would like to thank the BICC digital ministry for their time. I mean, I really don't know how to thank them because there's no amount of thank you I said to them that will be enough because they have already this morning done the Sunday service and they stayed behind to help us out. We are very grateful. The medical team, we are very grateful to you, the digital team. Thank you and God bless you. Thank you. Bye-bye.